Hey, Dr. Tracy, general pediatrician, and let's talk tongue ties in newborns. So this is a common thing that we see in the pediatrician's office, and we get a lot of questions about it. I saw a few today, so I figured let's talk about it. So in newborns, they can sometimes have a tight, upper, what we call frenulum, that little piece of tissue that attaches sometimes between your middle teeth, but definitely above it. They can also have a tight tongue underneath their tongue, like a little frenulum underneath there. There's some people that talk about like buccal or on the side of the cheek tongues, but I'm mostly talking about the upper and lower. Those can sometimes look a little tight. Have you ever seen those kiddos that can't get their tongue past their teeth? And this is something that has gone on and off out of favor for doing something about. So why is it potentially a problem? It's potentially a problem because if a newborn baby cannot get their tongue over their mouth, over their lower lip, it makes it really difficult for them to nurse. And so they really need a specific kind of latch where the upper lip kind of flays up as well as the lower lip does as well. And then the tongue is able to go past that lower lip a little bit in order to get a really deep latch in order to breastfeed. And so in some cases, there can be a mismatch between the anatomy of the baby's mouth and anatomy of the mom's breast on how the baby can latch. This can also affect bottle feeding, but it's more specific for breastfeeding. So when should this be treated or cut? So we used to, long time ago, if we saw them in the newborn nursery, they would just immediately clip the lower frenulum. And then they started to notice that it didn't help breastfeeding as much as they thought it would. And there were sometimes some complications where the pain from clipping the lower frenulum or the tongue tie actually caused the babies to not want to nurse. Then they needed to introduce bottles, and it really impeded breastfeeding long term. And so the risks kind of outweighed the benefits. So it started to kind of fall out of favor. And by the time I went through training 20 years ago, it really was in that phase of I'm not sure we need to do very much about this. And it's kind of waxed and waned as science does through the years. It was maybe it's a problem with speech. If they can't get their tongue to the roof of their mouth, it can affect their feeding. So when should we do this? So the current evidence says that if your baby is latching well, it is not exceptionally painful, they are gaining weight, and there is no complications, there is no reason to clip them, even if they seem super, super tight. So it does not matter how bad it looks. If the baby's doing all those things, it doesn't need to be clipped. It actually can be more dangerous in those cases to clip it because, again, if the baby has pain or there's complications from it, it can actually more likely impede breastfeeding. So when should this be evaluated? If after 2 weeks, the baby is not gaining weight very well, it is going to impede breastfeeding, it is causing significant pain for the mom, and it also, if it impacts bottle feeding at all, it really should be evaluated. The only other reason it should be done sooner, if it is so severe that in the newborn nursery the baby is not able to latch at all, there are some times where it's done in the newborn nursery. So again, this new evidence suggests we're kind of all on the same board. Pediatricians now, ENTs, and lactation consultants are all kind of in this, let's give this 2 weeks. Unless it's really severe, let's give this time. And the pediatric dentists are also involved, and they have a laser that they can do some of these tongue and lip ties, and we certainly utilize them to help us with that because a lot of general pediatricians are not trained in this because, again, when we trained, it wasn't something that was done very routinely. So certainly something to ask your pediatrician about. Talk to your lactation consultant. Ask if it is something that could be a problem, but it isn't routinely an issue. So it really matters, how is the baby doing, what's going on. So like all things, nothing is written in stone. Babies don't read textbooks, and we need to look at the whole child to determine if the risks of a procedure is worth the benefit that you might get. So I hope this helps someone understand why we do it, why we don't. But again, ask your pediatrician. We are there for help, and we want to be there for you during this time. And congratulations on your newborn. Take care.